Support comes from Hampton Roads Community Foundation, partnering with donors from all walks of life to improve southeastern Virginia through grants, scholarships, and leadership initiatives. Learn more at hamptonroadscf.org.
Hello, everyone. I'm Barbara Ham-Lee. In this edition of Another View on Health, the continuum of care for those experiencing a mental health crisis. The numbers are alarming. Almost 20% of African Americans in this country experienced a mental health condition in the past year, and 5% experienced a serious mental illness. Suicide is a leading cause of death for Black people between the ages of 15 and 34. So where do you turn for help? What is the impact, not only for the person experiencing the crisis, but family members too? We have a group of mental health experts here with some answers. That's coming up next on Another View, right after this national, regional, and local news from NPR and WHRO News.
Discussing today's topics from an African-American perspective, this is Another View.
Good afternoon, everyone, and welcome to Another View. I'm Barbara Ham-Lee. You know, I got to talk to you about some things happening in the community first before we get started with our show today. So I want to remind you all that the Teens with a Purpose, and you know, that is an organization that's been working with youth in this area and making a tremendous difference. They're holding their 17th annual fundraiser gala. It is Saturday, November the 1st at 6 p.m. at Slover Library. Now, Deidre Love, who they call Mama D, and she started this organization 28 years ago. She has retired, y'all, and she is turning over the organization to her son and to some other young people who came through the program and are now helping youth move forward. So let's give them some support if you can. Go to twp-themovement.org to purchase your ticket or to make a donation to that organization. They are doing some really incredible things. In Yorktown on Wednesday, November the 5th at 6:45 p.m., there will be a documentary about the Black community known as the Reservation. Now, these folks were displaced for the construction of the Yorktown Naval Weapons Station. And Dr. Jackie Bridgeforth Williams will be speaking and also showing the documentary and giving you that history. This is being held at Grace Episcopal Church, Yorktown, and that's on 111 Church Street in Yorktown. For more information, you can go to info@gracechurchyorktown.org. It is free. Go and check out that information about that community. And speaking of communities, join us next Thursday live from Fort Monroe. We are going to be talking about the contributions of Black people to the development of early Virginia and early America as part of Virginia 250. Celebration of this country's 250th founding, and we are going to be at the African Landing Memorial Plaza at Fort Monroe. So it is free. You can come sit in the audience, watch us do the show, but you have to register. So go to whro.org/events and reserve your seat, and we hope to see you there. So you know that it's the last Thursday of the month, which means it's time to talk health. So happy to say hey to my favorite co-host, Dr. Keith Newby. Hey, Dr. Newby.
How are you doing today, Barbara?
I'm doing good. He's a cardiologist, y'all, for those of you who may not know.
Yeah. Work with hearts.
And you have one more month.
One more month. Actually, less now.
Less than a month.
Because the 23rd of November, I am done.
23rd of November, he will have his master's in public health.
Absolutely.
Congratulations.
Thank you very much. I'm going to tell you, if I don't have to write one more paper in my life, I'm going to tell you. But that's okay, though. But the learning experience has been phenomenal. And I really almost encourage everybody that's in any medical field, look at that, because you'd be surprised how much that integrates that we don't even realize.
Yeah.
That
You know
aspect.
what I find just so wonderful, because you really could sit on your laurels as a cardiologist. I mean, seriously, you went through all of those years of education. You've been running your own practice, working with the hospitals, et cetera, but yet you found, I need to go back to school. I need to keep learning.
Well,
And that's a lesson that we need to learn.
Well, COVID initiated a lot of that. When you look at the rollout and all the issues that came as a result of communication, sometimes lack thereof. And I kind of say, okay, I can complain about it or I can do something about it. And you know me, I'm a person of action. To me, I'm not one to sit around and just say, let somebody else take care of it. If I can make the impact, I'm going to do it. And that's what I decided to do.
Yeah.
No regrets at all. But again, tired of writing papers, but I'm otherwise okay.
Well, congratulations.
Thank you.
Now, the one thing I wanted to mention before we get into our conversation about mental health, and really this does affect everyone's mental health, we kind of have a tsunami of things that are going to be happening this weekend that are going to affect a lot of people.
Yep.
We have the government shutdown, which continues,
Yes.
and that has affected many in our listening area and in this country. SNAP benefits will not happen. Although Virginia, we are lucky in that Governor Youngkin did declare a state of emergency, and there will be monies given,
Right.
but overall their SNAP benefits won't be there. And then the rollout of the Affordable Care Act and the increase in the amount of the premiums is coming. What words of encouragement do you have for people as they go through this? And I want to give you an example. Last evening, WHRO had an event at Virginia Wesleyan University, and they served food, and then saw a documentary produced by our own Lisa Godley, by the way. And a couple of people came in, one with the family, and they ate, and then they left. And they were looking for food to feed their family.
It's really unfortunate that we're living in this time in the 21st century. You would think this would be something we would never have to deal with anymore, but this the reality of what we have. I was to say to everyone, stay encouraged. If you are religious, stay in prayer, but look at what your options are. And I would encourage people to look at a lot of churches, my church in particular, First Baptist Butte Street. We have a food pantry that we do every Saturday. And we have plenty of options for people to come, and it's free. You don't have to pay anything for it. And I will say many churches have food pantries. And I think if you explore those, you will be able to, and we try to make everybody feel welcome. And we don't want anybody to feel like they have to be embarrassed coming out, because there are a lot of people in your same boat. So if you have the need, I say come out, see what's there. We make sure we make it open to everybody, as many churches and other organizations do. So I would say stay encouraged with that. We'll get through this. We'll get through this time. We just have to stay in prayer, stay encouraged, and find those options out there. They are out there, and they're plentiful now. Like the food bank, I know has been having some difficulty in getting some things, but I think if you look overall, there are many options out there that we're going to make sure we leave open.
And
for people.
it's so interesting because this is really hitting people who are not used to having to go and ask for help because they've been able to be self-sustaining and they've been able to take care of their families. But no paycheck is no paycheck.
I know. I mean, so I think if we kind of look at it from that perspective of how do we, and I tell people about plan, look at where you are financially and how you can start looking at savings, because I think you really need to start putting things away for that rainy day. So I would encourage everybody to look anything unnecessary, try not to purchase right now. Save your money for the things that you're really going to need, because your bill's still going to be coming in, rent still due, mortgage payments, all the utilities that we have to have. We're getting ready to go into the winter months. So you talk about colder times. So make sure you do everything, look at cost-saving things to do, and I think that we'll get through this. We're going to stay encouraged to everybody, but we'll get through it.
Absolutely. Well, and it does affect our mental health as you go through this. So according to
leading right into this.
Exactly. The government's Office of Minority Health and other mental health care organizations, African Americans face significant mental health challenges, including increased distress from systemic racism and historical trauma. Yet Black adults are less likely to receive help than their white counterparts. And if they do get help, often it's of lower quality of care. Our guests today on Another View on Health are changing that dynamic one patient at a time. Please welcome Dr. Shantae Williams. She is Chief Operating Officer with Life's Journey. Hi, Dr. Williams.
Hello.
How are you?
I'm so glad to be here.
Thank you so much for joining us. We appreciate
Absolutely.
that. And Akelia, did I say it right?
You sure did.
Akelia Wallace. She is the Business Development Liaison with Gateway Behavioral Health Services. Welcome to Another View.
Thank you so much.
So, ladies, I want to ask you all. Well, first of all, let's start with Life's Journey. Exactly what is Life's Journey? What do you guys do?
So
in terms of mental health?
we are a comprehensive mental health and substance abuse agency. We provide a number of services. We've been in operation for 9 years. So we provide mainly community-based services. What I mean by community-based services is that we go to the individuals that we serve. They don't come into our office as much as we go to them. So we have what's called assertive community treatment. It's a evidence-based, multidisciplinary, team-based approach whereby we have a team of professionals, including nurses, psychiatric staff, mental health professionals, and some more. And we work together to serve those individuals who have serious mental health concerns. We go to them in their homes or in their community and support them with maintaining their daily living skills as well as maintaining their health and their mental health. So we have that service. We also have mental health skill building service, which is a similar service in that we go to individuals in the community and we help to train them on the skills that they need to be independent in the community and the skills that they need to manage their health and their mental health. We also have outpatient therapy where folks come in to speak to a therapist. And then we have crisis services as well. We have a 23-hour crisis receiving center.
And that just started, right?
Yes, that's our newer program where folks can come in if they're experiencing a psychiatric crisis and get seen immediately by a psychiatric provider, nursing staff, therapist, get some support right there in that moment, get connected to referrals for ongoing care. And so that's what we do. We've recently been licensed for our substance use residential treatment center, but it's not open yet, so that's to come in the next 60 to 90 days.
Okay. You really do take the continuum
Yes.
across the board, don't you? All right, let's find out before you ask your question.
No, so hence Life's Journey.
Yes,
Life's
so
Journey,
hence
yes,
my journey. That's just what I was going to say. Absolutely. So Gateway,
Yes.
Akelia, what exactly do you all do?
So at first I want to say we go by Gateway Behavioral Health Services,
Okay.
GBHS, because there is another gateway out here, just to have the differentiation.
Okay.
But what we do is community stabilization. And so essentially what we do is similar to what Shantae was sharing, having a team set up where a team approach where we're servicing clients in the community who are dealing with mental health stressors or in a crisis state that needs stabilization. We can go into it. It's so many different facets because a crisis looks so different from, this person to the next. And so what we essentially do, though, is just do care coordination to make sure that they can get to the resources if they are just in a state where they can't even think of what to do next. And we help them think through things. A lot of times people are dealing or feeling with a lot and they can't put the language to what they're feeling. And they might just be dealing with significant grief. And so that's essentially what we do. We step in in the vulnerable moments of individuals in our community and assist them with getting stabilized.
So with Life's Journey, I noticed you call it a 23-hour crisis center. Why is that?
We call it 23-hour, one, because that's what the state mandates. But we're there in the short term. We're not a hospital, so we're not admitting folks for ongoing care. We can keep them for up to 23 hours. After that 23 hours, we're referring them to another level of care, whether that's they still need some support, they need some monitoring, they can't be left alone, so they do need to go to the hospital, or it's the crisis has de-escalated. We've been able to provide them some support. They can step down to go home and see their therapist next week or get connected to another resource for ongoing care.
So I think people who may not have experienced someone who's having a mental health crisis or whatever, can you walk through what happened? What are you experiencing as that person walks through the door? Do you know what I'm saying? So
Absolutely.
what are they going through? Who are they with? Give us a
Yes.
kind of a sense of what
Like
happens.
Akeelia mentioned, it can
Yeah.
look so different for each person. We've had folks who have come in because they're experiencing the first episode of psychosis, which, as you can imagine, is a jarring experience for anyone. If you've had what you would consider to be a normal uh, life, to all of a sudden start having psychiatric symptoms is a very scary experience for people to have. So
Mm-hmm.
we've had people who are having their first episode of psychosis. So all of a sudden they're experiencing hallucinations or they're experiencing paranoia and they don't know what's going on really, but they know something isn't quite right. I need some help. So they're coming into our crisis center. Other times we're having folks who have been suffering from depression or anxiety for a long time, but their symptoms are getting to the point where they feel like, I've been able to manage this, I've been able to handle it, do my coping skills, whatever the case may be, but right now I'm at a place where I can't take it anymore.
And are people coming on their own, or are their family members bringing them, or it's
We've got
a little bit of all of it?
a little bit of all of it. We've got people who are coming on their own. We've got people whose family or friends are telling them, you need to go over here. Or people who have been in touch with other agencies and they're saying, you know what, go over here because they might be able to help you.
Mm-hmm.
If I can tap in
Yes,
really
sure,
quick. So
absolutely.
that's kind of how we got partnered, because a lot of times people will hear about our services and they will come to us and they're experiencing something that we would call a higher level of care. And so when that happens, that's when we make a phone call and we reach out to Life's Journey and say, hey, we've got a client that's looking to be in services with us. However, they really are going to better fit for what you have to offer.
So you guys partner
Yes, ma'am.
with each other
Mhm.
and do referrals with each other.
I was just going to ask. So I know now. I remember you saying that you go to people a lot, but I'm assuming you have an office.
Oh, yes.
So is it several or just one in location?
We have several locations, but for our crisis center, we have one location. We're on 1003 Norfolk Square,
Okay,
which is right behind the police station.
gotcha.
Mhm.
You know, one of the things that struck me this week. So Sean Grayson, he's a former deputy with the Sangamon County Sheriff's Department near Springfield, Illinois. He was found guilty yesterday of second-degree murder in the killing of Sonia Massey. What struck me, and the reason I bring that up in this conversation, was Sonia's mother had called police to say, my daughter's having a crisis. And please don't hurt her. Was and later on, as they listened to the 911 tapes, that's when they found out. Well, obviously she succumbed to the worst. But what is calling the police the best thing, the worst thing? First of all, Akeelia, and why would that even be a fear to begin with?
So it shouldn't be the worst thing. However, what we've seen, unfortunately, you don't know what's going to come with the end of that. So what we try to encourage individuals who have any kind of mental health challenge is to call 988. That's the mobile crisis hotline. I'm not sure if you're familiar with that, but that mobile crisis hotline is going to prompt a mental health professional to arrive. And if a police officer is needed, that mobile crisis responder can select to have law enforcement backup. But it's a very rare occasion where that's even required.
Because I think that people don't know where to turn. Is that what you find,
Yes,
Dr. Williams?
and the new crisis services that we have in Virginia are actually in direct reaction to the Marcus alert and situations like what you just described with Miss Massey. The state has realized, this is not the best way for us to deal with people who are in mental health crises. Our police officers try as they may, even when they're trained in crisis intervention, they're not mental health professionals, and so they're not the individuals who are best equipped to deal with individuals who are experiencing a mental health crisis. They need someone who understands their diagnoses and what's going on with them and their symptoms and things like that. And so it's really great that we have 988 and mobile crisis response now in the state to help those individuals who are in need of immediate action. So I absolutely agree with what Akeelia said there.
And speaking of 988, if you are finding yourself in a crisis situation, as we're talking during this next hour, please dial 988. You can call it, you can text it, you can find out and get help immediately. So, real quick number to remember: 988 Lifeline. Why are people so afraid of people with mental challenges?
I think it's the lack of education behind it, especially for our people. I think a lot of times when we think of mental health, we think the extreme, we think erotic, we think it's just all over the place and crazy. When we're all really touched by it, especially during this season.
And what is special about this season?
Daylight savings coming up, right? We're about to start losing some daylight, right? And so a lot of times during this time frame, you see a shift where, seasonal depression starts. And Shantae, you're the doctor. You can speak more on this, but honestly, and especially in our community, I think it's just the lack of education around it. And as much as we like to talk about it, we're saying, and I'm glad that we're talking about it more now, but there's still so many people who don't really understand mental health and the word grief that I brought up earlier. A lot of people don't know that they're dealing with grief. They don't have the language to know what is it that I'm feeling? What is it that's going on? You see someone acting out or just strange behavior and they don't know how to explain it, but it's mental health. Shantae.
Absolutely. And I think also about this season, you mentioned grief, and that plays a big role. When we think about this season, what do we think about? We think about the holidays. We think about spending time with our families. And for a lot of people who are struggling with mental health, they've had relationships that are fractured as a result of their mental health. And so maybe they're not able to spend time with their family members in the way that they would like to. So it's a harder time of year for them. And then especially those who have experienced loss. We're remembering those that we lost. We're remembering those holidays and those good memories, but also longing for those times. And so it can be a really difficult time of the year for a lot of people.
What are the ramifications for the family? Because I know, Keith, when we talk about heart disease, when we talk about all the physical things that people have to deal with, and you all of a sudden have to become a caretaker and caregiver rather, and so forth. But what are the ramifications for the family when someone has a crisis, or if they may even be maintaining, once they've been diagnosed, I guess, and realize what they're dealing with?
I think it's very similar to if anyone's had any experience where a family member has become disabled physically. It's very similar when you have a family member who's struggling with a mental health diagnosis. You might have to, in the same way you might have to think about how to adapt your life or your home around, someone's physical disability. You might have to think about that in the same way for someone's mental health challenge. What impediments might be existing in our home or in our family structure to how this person functions? How might we need to change the way that we communicate, change the way that we live and do life to support our loved one? And, that's not always an easy lift. It can be a hard lift to do that. But it's a reality for a lot of people, just thinking about the way that we do things now and how that might need to change. Everything from how we eat, how we spend time with each other, how we eat dinner, how we communicate with each other, all of that may change. So it is sometimes a heavy lift for the family members and the loved ones of individuals who are experiencing a mental health disorder, because they, as the person who's experiencing it, may be learning what are their triggers, what are the things that make them well, what are the things that make them not well. Their family is learning it as well, and then having to adjust to that as well.
Yes,
Two words came to mind: expectations. And so those expectations, they have to change. And the second word that came to mind was pivot. So you just kind of pivot as life changes. That's what the family is going to have to do. I mean, and it's on both sides, because I believe both people are impacted. So you might not be the person who has the diagnosis. However, your life just changed as well. And so it's all about pivoting. But having that positive regard, I think, is really what makes the difference of how we're able to
and
get
like
through.
you were saying, understanding and learning about the particular disease or the particular illness, mental illness that they may be facing.
We have to, in our world, I think that's the importance of obtaining social histories and really developing a trust relationship with the patients you have to deal with. Because what I've found is that a lot of times you'll run into people who have mental health challenges, but they come manifest as some type of just like symptom, chest pain, shortness of breath,
Right.
or palpitations. And I think the important part that I always encourage the younger doctors now is don't blow off the social history, because once you start digging and you start understanding their background, you sometimes pick up things that you can say. The hardest conversation, though, is when you have somebody who's convinced. Like, I got to deal with people who are convinced they have a heart problem, and I'm like, they really don't. They're anxious about some issue, or they have some type of disorder, and they, you're trying to figure out, how do I have this conversation with them, because you don't want them to feel like you're just saying you have it's a mental problem, but it's manifesting itself that way. And that's probably one of the hardest conversations I've had, is how do you bring that up when you've done your workup, they really do not have a predominant medical problem, physical problem, but you do want to see them get the help they need. So, and the really unfortunate, so I know it's a shortage of you guys around. That's getting access to the care is not always the easiest. So I thought I welcome this conversation today.
Absolutely. If you're just joining us, we're talking about available mental health services in our community. Our guests include Dr. Shante Williams, Chief Operating Officer of Life's Journey, and Akeelia Wallace, Business Development Liaison with Gateway Behavioral Health Services. I'm also joined by my co-host for Another View on Health, cardiologist Dr. Keith Newby. 757-440-2665 or 1-800-940-2240 are the numbers to call to join our conversation. Let's talk to Elena. And Elena, I believe you're calling from NAMI, right? The National Alliance of Mental Illness?
Yes, I'm with NAMI, Coastal Virginia.
How are you?
I'm doing pretty well. Thank you for giving us a chance to talk about NAMI.
Okay, tell us about what NAMI offers in the community.
So NAMI is a national organization. It's the nation's largest grassroots mental health organization with over 650 affiliates. Our local affiliate is Coastal, which encompasses Norfolk, Chesapeake, Virginia Beach, Eastern Shore, and Portsmouth. And so we offer free education, classes, support groups, and workshops for individuals who are dealing with mental health challenges, as well as for their family members who are willing to support them. NAMI is great because it's all peer-led.
Oh, okay. So this is peer-to-peer counseling. Am I correct?
Yeah, it's all peer-led, exactly.
And how do people get in touch with you?
So our number is 757-499-2041, and we offer a support group for Black, Indigenous people of color that meets the first Thursday of each month virtually. You'll find that in all of our classes, a peer-to-peer class, family support group, all of that information on our website, which is namicoastalvirginia.org. You need to spell out the Virginia on there.
Okay. And tell me that phone number one more time.
It's 757-499-2041.
2041. Okay, great. Thank you so much, Elena, for calling in. We appreciate that. We want to make sure that we give out as much information as we can, because as you were saying, Dr. Newby, there aren't many. And that is a shortage. And one of the things that I've been reading about as I was preparing for this show was a lot of talk about cultural competency in terms of dealing with patients, particularly African American patients, and there was only 2% of mental health professionals, doctors, psychiatrists, 2% are Black. That's it. So clearly, if you're going to get help, then you may or may not be able to see a professional who looks like you, but there are opportunities to train others to be culturally competent. Why is that important, Dr. Williams?
It's so important because our cultural experiences shape the way that we see life. It shapes our perspectives in every single way. And if you are a therapist or a counselor or a social worker, and you are not able to take into account the context in which someone lives, then you're not able to really understand the problem. Even when we learn about diagnosing, you cannot diagnose someone without taking into account all of the social and cultural factors that contribute to their experience. And so it's very important because one might say, oh, I hear God speaking to me, right? Depending on your religion, you may feel that you're being led by the Holy Spirit. And if I'm from someone and I don't understand that concept, I might think you're hallucinating. Even something as very simple as that, or whatever your cultural beliefs are about your ancestors or, your family members or your friends and things like that. If you're not looking at things through a cultural lens, you can misinterpret a lot of things, and it can be seen as disordered thinking, and it may just be cultural thinking. And so it's very, very important that we have clinicians who have cultural competency and are able to listen and understand before making diagnoses or making judgments about people's mental health.
And Akeelia, I would assume then also the whole idea of explaining maybe to that loved one that comes in with that person that mental illness is real, because in our community we are all about like you said, pray. Let God handle it, and we don't need the help. And so if you are culturally competent, that's another way that you can help to help the family come together around that person.
Absolutely. And I think peer support is great as well. I believe you all have peer support as well, but having someone who's kind of been through this and walked this line before, especially if we're dealing with substance. If you're talking about substance abuse and things of that nature, and the mental health components that even got them to, start self-medicating through that substance, having somebody that's already walked this line with them that looks like them, might not be that clinician, which we love and we want more clinicians, but having that peer support specialist as well, just kind of support with that educational piece from their lived experience. I think that's been a great support.
How often is substance abuse the trigger for greater mental health?
I would argue that mental health probably started first. Some kind of mental health challenge. That's just kind of my personal belief. I'm not going textbook here. I'll let the doctor do that. But there has to be something that has piqued that interest. I mean, it could be just a cool thing, kids. You started. Oh, my friends are doing this, whatever. But there's usually something going on which causes that addiction. And so I think the mental health element was present first.
I think the delivery too, to piggyback on something you said earlier, when you're culturally competent, your ability to be able to deliver a message, when you engage in conversation with someone, that pivot comment you made earlier, even that relates in our field as well, because you have to be able to, when I see a patient of different cultural backgrounds, I have to adapt to that change when you go from one person to the next, and the ability to be able to deliver a comment or a message, or to be able to have that lived experience where I say, okay, I know I've been down this road before, or I understand what you're going through because I've seen it plenty of times growing up. That does have market impact, because if you have somebody who really, for lack of a better term, grew up with a silver spoon in their mouth, they may not have ever had those lived experiences. Because even one of the shows we did a couple of years ago, a comment was made. I think we were talking about WIC or something we were talking about, and somebody called in, and they weren't the kindest in the world in some of their comments. And I said, well, until you've grown up in this, example, you hear somebody famous last words, these people just need to pull themselves up by the bootstraps. I'm like, well, if you never had bootstraps to pull on, you don't know. And that's where I try to get people to think you have to live that person's life or understand what they've been through before you can pass judgment. It really shouldn't be passing judgment regardless, but in order to deal with them and to communicate, you have to have that lived experience. Well, at least you need that, I should say you have to have it, but it's helpful because as the receiver coming into an office, you just think by putting yourself in that patient's place. They're coming in, they're scared, probably anxious, not sure what they're going to experience. And here's you come in, and if they can't relate to you, it's difficult to grow a relationship with that person, that they open up to you in the way that you need to be able to help them the best way you can. So that lived experience is important. I don't care what anybody says. It really does help.
Yeah. Dr. Williams, you said that your folks go to the patient.
Yes.
And so you go into their environment.
Yes.
Do you work within that environment, or do you try to change the environment to help? If the environment is a part of the problem,
Absolutely.
you
So
know.
we have had folks who we've walked into a home situation and said, "Oh, okay, now I understand what's now I understand what's the problem. Now we're going to
Mm-hmm.
have to change and fix some things around. This might not be a healthy environment for you to be in, because maybe the person's struggling from substance use and they're living in a place where everyone is abusing substances, for example.
Mm-hmm.
This is probably not the best environment for your recovery. So, well, what other options are there, and how do we work to get you in a different situation? But then sometimes it is us working with the family and the people who are involved. Sometimes the family dynamic is not a healthy one. But that's
Mm-hmm.
something that can change. So if we're able to engage their natural supports, mom or sister who also lives in the house, and we're like, well, we're working with your brother here on these type of communication skills. We wanted to share it with you too,
So you
because
basically wind up counseling
this might
everybody.
be
Yeah.
helpful, and
Mm-hmm.
and you can start to see some change, because sometimes people only know what they know, and they haven't been presented an alternative, and so a lot of times people are looking for a better way, and they're very receptive, and open to learning new things and to being able to grow and develop. So
757-440-2665 or 1-800-940-2240 are the numbers to call to join our conversation. What questions do you have about mental health, or about what you need to do if you think that you may need some help? Give us a call, 757-440-2665 or 1-800-940-2240. Amy joins us from Norfolk. Hi, Amy. You're on the air.
Hey, thanks for talking to me.
Mm-hmm. What's your question?
Sure. So I was calling actually just to kind of comment on the substance use link with mental health. So we have a study right now. I'm with the medical schools, Eastern Virginia Medical School Pediatrics, and we have a study right now called What's Up with Teen Marijuana Use. And what a lot of parents don't know is that there's an association between marijuana use and development of some major psychiatric problems like depression, anxiety, suicidality, and schizophrenia, like illness called cannabis-induced psychosis. And so a lot of people don't know that link is there. Our study is currently talking with parents about their experiences, thoughts, and feelings about teen marijuana use. And we don't want to demonize marijuana use. We know that a lot of people use it, but certainly in a developing brain and the increasing amounts of THC, we're seeing increasing amounts of mental health issues. And a lot of people think that it's a treatment for mental health issues, when we would really like to see them, especially for teens, not do that. But right now, in particular, with our study, we have some additional funding from the National Institutes for Minority Health Disparities, and are also partnering with Norfolk State because African Americans are underrepresented in the study right now. And so I just wanted to mention that because it's really important that we hear from the African American community in studies like this, because we're going to be hopefully creating solutions and supports and resources for parents and teens and schools and communities. And we can't do that the right way unless we're hearing from everybody. And in particular, making sure that our approaches are culturally sensitive. It's hard to do that when we don't have enough people participating in studies like this.
So, Amy, if someone wants to participate, how do they do that?
Sure, they can reach out directly to me, actually, and I'll be glad to hook them up to the survey. So they can reach me at 757-446-6116. That's my office number, and I'll be glad to talk to them about how to connect them with the survey. We're not putting it online because we have trouble sometimes with survey compromise, because there is a gift card that goes with the survey. But I can definitely hook them up directly. And then they might see us out at some community events around the community. We were out at Booker T last night. We're going to have some people out in Portsmouth tonight. So really just, if you see us out there, please take a flyer. Please share it directly with people that you know who have kids ages 11 to 19, because we want to make sure that we're including the African American voice in this, and that we're also getting the word out to the community about the potential harms, especially for a developing brain, on the use of THC, because the amount of THC, because of commercialization, has gone up in the product exponentially. And so we're starting to see real significant harm.
When you were talking about that, both of our guests were nodding their heads. So I want to get their responses to that very issue. But that number again is 757-446-6116. Is that correct?
Yes, ma'am.
Okay, and Amy at EVMS. All righty. So, and we do need people in the study, don't we, Keith?
Yeah,
we've talked about the fact that we are
Well, she should have never said that to me, because you know how I am about that marijuana stuff. I'm on people all the time about that. And I have always sung that song. People look at it as like it's no big deal, and they say, well, it's not cigarettes. And I keep preaching this song. I said, listen, this stuff is not risk-free. I say, now I didn't know this one, so this is my next ammunition tool I'm going to use to try to get people off this stuff. I mean, but it's just, and again, there are some medical uses, don't misunderstand, but it's just the abuse that I see. And, and like I told you, every time I walk in the hospital, I've not walked to the hospital in the last 3 years. I don't care if it's I don't care if it's 5 in the morning. I don't care if it's 11 o'clock at night. I'm going to walk through the neighborhood. I'm going to smell it, and it's like, and I don't want people to think that everything is just risk-free. And hearing that's all I need to hear. I'm on it now for sure. Anyway.
Dr. Williams and Akeelia, what do you guys were nodding your head when she was talking about the impact on us. Then we were talking about children ages 11 to 19. 11?
Yeah. I think
younger than that.
I think it's hard to find someone in our field who doesn't have, anecdotally at least, a couple instances of individuals who have a marijuana-induced type of psychosis or something like that. It's a story that we hear often enough to cause concern and to caution people to have some caution with using marijuana for sure. Of course, there's several positive uses for it, but I think I know I've seen it personally and professionally.
So what is a marijuana psychosis? I mean, break it down for people who are like, what? They were just high? What?
In the most simplistic way that I can put it, somebody smoked something and they weren't right after. After that high, something happened.
Something happened to them.
Their brain chemistry changed, and their reality was no longer their reality.
That education piece I was talking about too.
Mm-hmm.
Just the lack of that knowledge that a lot of our people don't have around these things. I think we really, and I'm glad she called in to kind of give us a little bit of information about the study that they're doing, but it's there's so much that we need to know about what we're doing. Because we can, like I was saying before, my personal thoughts, right? But there's science behind this. And I don't know. I really, wish our community would take these things a little bit more serious, and of course, don't think to just pray it away.
What is the biggest myth about mental health that you guys would like to dispel, that you wish people would not believe or think?
That it's not real. That is not real. I think a lot of people, especially in our community, we don't see mental health or mental illness as a real illness that requires treatment, that can get better.
So we don't look at it as like a broken arm or a
it's
heart
just in
disease
your head
or something like that.
It's just in your head. You can put that out of your head and you can be okay. And it's a real illness. There's brain chemistry, and your brain looks different when you're depressed. Your brain looks different when you're experiencing a psychiatric crisis. There's real things going on within the chemistry of your body, and there's real medicine to treat these conditions, and there's real other forms of treatment like talk therapy, in the same way that you might take your aspirin for your knee, but you're going to also go to physical therapy. You might need to take a pill for your depression and also go to therapy. And so starting to look at mental health as a real condition and a real illness is, I think, something that's needed in our community.
And it needs a real diagnosis and an individual diagnosis.
Individualized
right?
care, absolutely, because the same thing doesn't work for everybody.
One of the things I wanted to ask you is, we run into this a lot in our community where, especially men, we look at any mental challenge as a sign of weakness, and then we don't want to seek help. So what can you say to the listening audience to let them know it is okay to have this? Just like I don't like people having a heart problem, but it does happen, and some things are preventable, some things are not. But I want people to feel like they can feel free to get the help they need, and don't look at, if you do have a challenge, it should be looked at as a sign of weakness. And I know, unfortunately, so that's the way I was brought up, that you just brush this stuff off and keep it moving.
Man up.
Yeah, man up. We get that a lot, So I think hearing something from you that will encourage people to say, if there is an issue, do not, I tell people all the time, embrace your issues and seek help to fix it versus ignoring it and letting it continue.
Yeah, you guys are a little stubborn.
Yeah.
There's some men in my life who, I might have to fuss at them even about taking their blood pressure pills, because
you right on
I'm
it.
fine.
You are talking right up his alley right now.
I don't need to take that. I'll be all right. And, I'll change my diet. I'll do my exercise. And it's like, yeah, do all of those things. And also take those pills that doctor prescribes you, because we want you around. Yeah. We want you to be here to experience your family. We want you to be able to share these moments with your children, share these moments with your grandkids. We want you around, and we want you to be around and well. Yeah. It's the same thing with the mental health. You can be present and unwell, or you can be present and well and able to fully enjoy, these moments of life that we have before us. So, I prefer for you to address that mental health issue, get some help, get the treatment that you need so that you can be here in fullness and enjoy these moments, as opposed to be in torment. Nobody wants to be in physical pain. We don't want you to be in emotional pain either.
Yeah. Mm-hmm. What is it about men and the suicide rate too? Because I was reading that that's increased, especially among Black men.
Ooh. Oh man, thoughts. Man, oh man. I think, like Dr. Hare was saying, a lot of men don't feel as though they have maybe even the room to speak on what they're feeling. But I truly think, as a true leader, you need to, assess yourself and see, okay, what's going on with me, and seek that help. Why is this happening? Without getting too political, is this a lot going on?
A lot going on.
It's a lot going on.
And I think also we talk about the lack of clinicians, period, but the lack of culturally responsive clinicians. I think in many ways it may be easier for women to access care, even if the care is not culturally responsive. But I think for our men, it is more difficult.
So you mean in terms of accepting it? Is that when you say that women are able to get it more easily?
Yes, I think so. I think even if we look at just the systems that are in place in our society, period, they're more accessible to women than they are to men of color. Even if we look at how our education system fares for Black women versus Black men, I think the mental health field is more geared towards a woman's perspective than it is a man's in general. And I think, that's something that has to change. We need more male clinicians. We need more Black male clinicians for sure. To start to give their input. And like the young lady was saying, Amy, about the study, we need the input of our folks in these studies so that the clinicians can be educated.
Right, because we want it to work for us. And sometimes it's different for African Americans and for other ethnicities or other races. And if we're not in the study, then they're pushing everything towards somebody else's ability to be helped as opposed to ours. So we need to get involved.
I mentioned to you, I think I told you this, Barbara. I had that gentleman call me up, and he and I go across the country doing these talks for African American men. One of the most interesting things I've found is when you get men in a room and you allow them the opportunity to start sharing. And you give them that free space, you'd be surprised what you hear, and the relief of stress that they could actually talk to somebody who's willing to listen. And sometimes, we don't want commentary, but just to be able to get it out, so giving them that free space, I found, has been extremely helpful as we kind of engage this. I had a church event a few years ago, and a bunch of men sit in a room, and we started sharing, and it was interesting, but you could see the stress level go down when men can actually
talk about it.
Because we are taught to man up and to not share and to not just keep things internal.
Don't cry.
Yeah, don't cry.
Don't be emotional.
Just deal with it. But I would actually challenge men to say that if you are willing to seek help, that makes you more of a man, because that means you're willing to accept that you do have challenges that need to be addressed. And to me, to accept those challenges and to go after them puts you in a better place to me. And that's just my opinion on that one. But I would actually challenge men to say you going after an issue that you have puts you in a better place, with everyone, yourself, your life, and your family.
Are we more, as a community, are we becoming more proactive about our mental health? Or are we still at that, I don't know about this.
I think we're getting better as long as we're willing to put that pride aside, and especially with this men thing. If we can put that pride aside and not feel like we're going to get victimized because we're dealing with this challenge, right? So feeling like there's a safe space to go to. I think with that, I think we've been making some progress, but it's hard. It's hard. To put your pride aside and not want anyone to use your vulnerabilities against you, because we're used to that.
Yeah, I think we're definitely going in the right direction. And a lot of it is just about the socialization of it. So even as he was just saying, you get men in the space and they get to talk and they're like, oh, this actually isn't so bad. But if they don't have those experiences, it doesn't lend itself to that. So like, I think even now, if I look at like the landscape of podcasts and things like that, we've got all these men sitting in a room together and they're talking about their life and their experiences. And so that makes it more normal for young men to talk about their experiences with their friends and family members. And then if there's groups available where they can do that same type of thing, it lends themselves to being more open to seeking treatment, more open to talking about what's going on with them. So I think we're moving in the right direction, slowly but surely.
Okay, Akeelia Wallace, tell us about where Gateway Behavioral Health Services are and how people can contact you.
Absolutely. So Gateway Behavioral Health Services is throughout the whole Hampton Roads. We are strictly in the community, so we come to the clients. We do not have an office where they can meet us. We'll come to them. How they can reach us, they can call 757-979-4148 if they're experiencing any kind of mental health crisis, and we'll assist them.
Okay. And Dr. Shante Williams.
So Life's Journey.
We
We have offices in Norfolk, Hampton, and Portsmouth. Our main office is 1003 Norfolk Square, Norfolk, Virginia. And we can be reached at 757-622-0700.
Thank you both ladies very, very much. And Dr. Newby, you have the last word.
I get the last word.
You get the last word.
Well, I would say this to everybody. Don't shy away from challenges you have. Embrace them and seek assistance to improve it. I think you'll find your ability to get through life's journey would be enhanced. And I do believe that you'll find that your mental health impacts your physical health as well. So when you think about that blood pressure problem or whatever, I think you will be able to deal with it better with a different outlook. So I say seek the help. Get it, embrace it, and run with it.
Thank you so much, sir. We appreciate it as always. And audience, thank you for joining us for this past hour. It is our hope that you are now more informed should you have to deal with a mental health crisis. You can listen to this show again or share it with someone you love by going to whro.org/Spotify, another view or Spotify or wherever you go to get your podcasts. Next week on Another View, we're live from Fort Monroe as we talk about the contributions to blacks to the founding of America. Go to whro.org/events to register and join us for our live audience. Our theme music is an original composition created for Another View by Jay Sennett. Lisa Godley is our show producer. Jordan Christie is our audio engineer, and Dr. Barry Graham answered our phones. I'm Barbara Ham-Lee. Have a wonderful weekend, everyone, and let's get together again next Thursday at noon for Another View.
Support comes from Hampton Roads Community Foundation, carrying out your charitable wishes forever, whether it's helping shelter animals, feeding the homeless, enhancing the arts, or supporting students. Learn more at leaveabequest.org.